Have you ever noticed how your tongue can instantly find a single grain of sand hidden in a bite of food? The human mouth is densely packed with nerve endings, designed to act as a hypersensitive alarm system for the slightest shifts in temperature or texture. Yet, despite this hair trigger sensitivity, a massive biological blind spot exists. Right now, rogue tumors are multiplying inside hundreds of thousands of mouths without triggering a single pain receptor. The sheer scale of this unseen crisis is staggering. Each year, over 377,000 new cases of oral cancer are diagnosed worldwide, ultimately claiming 177,000 lives. The extreme lethality of this disease comes down to a terrifying statistical reality. 80% of early-stage oral cancers present absolutely zero symptoms. We are psychologically conditioned to equate a lack of pain with being healthy. Because of this blind trust in our body's alarms, patients routinely ignore stubborn sores or visual changes for months. This cancer's biological success relies on growing entirely above the pain threshold, bypassing the body's natural alarm system until the damage is advanced. To understand how this happens, we have to look closely at the mouth's inner lining. It is made of flat, scale-like structures called squamous cells. To handle the daily physical stress of chewing and swallowing, these cells are constantly dividing and replacing themselves. This rapid, necessary replication cycle is exactly what makes the tissue vulnerable. When these fast-healing cells are exposed to harmful external toxins, the chances of a copying error, a dangerous mutation, spike significantly. Historically, the most common trigger has been tobacco. Whether smoked or chewed, tobacco introduces dozens of specific carcinogens that directly assault and damage the DNA of these fast-replicating squamous cells. When heavy alcohol consumption enters the mix, a dangerous chemical reaction takes place. The human body breaks down the ethanol in drinks into acetyl acetate, a highly toxic compound that further degrades cellular DNA. The combination of tobacco and alcohol triggers a synergy explosion. Together, they multiply the cellular threat, resulting in a 30 to 50 times higher chance of developing cancer than using either substance alone. Through these repeated chemical burns, the mouth's natural repair cycle is hijacked. Instead of healing naturally, the damaged DNA forces the squamous cells to aggressively mass-produce into chaotic, irregular tumors. But the typical profile of an oral cancer patient is changing. Diagnoses are steadily climbing among younger adults who have never smoked a cigarette in their lives. A major driver of this demographic shift is the human papillomavirus, specifically strains 16 and 18. This stealth viral vector is now responsible for a full quarter of all oral cancer cases in the United States and Europe. In other parts of the world, the primary trigger is entirely mechanical. The widespread practice of chewing betel quid or areca nut subjects the mouth to severe, sandpaper-like friction, irritating the tissue and driving up cancer risk eightfold. Regardless of the cause, the biology of why these tumors remain painless is identical. The mutated cells form as tiny patches on the top tissue layer, far above the sensitive nerve endings. Growing downward, the tumor snakes past these receptors into the lymphatic system, spreading cancer before the patient feels a thing. Whether initiated by chemical damage, a viral infection, or severe friction, the tumor survives by quietly exploiting this massive biological gap, growing steadily above the body's threshold of pain. When physical discomfort finally arrives, often manifesting as referred pain, like an unexplained earache or a stiff jaw, the disease has almost always advanced far beyond the initial site. At the hospital, oncologists rely on the TNM staging system, measuring tumor size, lymph node involvement, and metastasis, or spread. This framework acts as a biological clock, dictating exactly what happens next to the patient. This chart shows the massive gap in outcomes based on that clock. If caught in its early stages, the 5-year survival rate for oral cancer is 83%. But once the cancer has spread to surrounding tissues, that rate plummets to 38%. Late-stage discovery requires grueling interventions. Patients face wide surgical excisions to remove affected mouth tissue, followed by aggressive rounds of radiation and chemotherapy. Modern oncology is fighting back. Minimally invasive robotic surgeries are preserving more function for patients, and targeted immunotherapies are actively helping the body's own immune system attack advanced tumors. Yet, despite these advanced medical safety nets, relying on complex treatments to cure a late-stage diagnosis remains a highly dangerous gamble against time. To survive this disease, we have to change our entire approach. We must stop waiting to feel a problem and start proactively checking to see it. This means grabbing a hand mirror right now and closely examining the inside of your mouth for specific warning signs. Look closely for thick white spots called leukoplakia, or dangerous velvety red patches that cannot be easily scraped away. Any physical anomalies, such as unexplained bleeding or a persistent sore that refuses to heal after 14 days, require an immediate clinical evaluation by a dentist. We can also eliminate major triggers before they ever cause damage. For the growing viral threat, a highly effective HPV vaccine is now widely available to neutralize the virus at its root. Oral cancer thrives by masking its deadly progression behind a complete lack of pain. Defeating it rests in your own hands, requiring nothing more than routine, visual vigilance.